Hi everybody. So my name's Isaiah. I'm a 29-year-old from Santa Fe, New Mexico. I recently, within the last week, had a bilateral inguinal hernia repair. And just looking on YouTube, I couldn't really find a lot of videos that kind of discussed what to expect kind of before and after the hernia repair surgery. So I just wanted to make a little something that would hopefully help someone else in my position or in a similar position with just going through the process, knowing what to expect. So let's go back. I had my initial onset of my hernia about 3 years prior to my surgery. I actually messed up my hernia, gave myself the hernia deadlifting. So I was doing some real heavy deadlifts, probably too heavy or more than I should have been doing. And at the top of my lift, I felt and heard kind of a rip or a tear. It's the best way I can explain it on my groin. And immediately, I knew something was wrong, kind of presented with some pain. It wasn't terrible initially, but over the next maybe week or so, I noticed there was a definite bulge in my groin on my left side that shouldn't have been there. Didn't really do much about it. I knew I gave myself a hernia as it progressed to worse over the next couple months. It didn't really affect me much unless I was lifting really heavy. Sometimes, just flipping tires, doing any sort of weird, activity, kind of explosive movement, it would affect me and give me some pain. So I ended up just kind of babying it, changing my workouts out and monitoring it and, using a belt every time I squatting lighter, deadlifting lighter. So that was about 3 years ago. Let's go back about a year prior to my surgery. I noticed, again, working out, that while doing single arm rows, I began to feel kind of a ripping tear, kind of that same sensation I felt initially on my left side, on my right. I felt some pain after about a week or so. It went away, didn't think too much of it, and I honestly didn't realize I gave myself a second hernia. So about a year later after that, I got a follow-up appointment for my job. I work for the fire department here in Santa Fe, and they said, your yearly physical examination's coming up, you better get that hernia checked out. So I decided, well, I'm going to go get it looked at. So I went to go see my specialist, surgeon here in Santa Fe, Dr. Sterling. He weighed the options of surgery. Obviously, the only way to fix a hernia is with surgical repair. Once you rip that part of your abdominal wall, it's not going to get better. There's nothing you can do to fix it other than surgical intervention. So I saw the doctor. He gave me the options as far as, open surgery, where they basically cut you open, find the defect and fix it, versus robotic, where they use the Da Vinci machine and they basically make the 3 incisions that are smaller in your abdomen, and they use a mechanical robot to fix your defect, or just monitoring it and leaving it. In my case, being a young guy, I'm healthy, I'm active, I have a pretty physical job, constantly picking people up. If we go into a fire, I'm a firefighter and a paramedic. I need to, be able to rescue someone, knock down walls, open up cars. And just in my personal life, I do mixed martial arts, I work out, I try to be active, I run. My concern was I wanted to make sure that I could do those activities after my surgery and that I wasn't going to impede that. What the doctor recommended is that I definitely fix it, obviously, and from what his recommendations were is laparoscopic. Basically, he informed me that laparoscopic would be a quicker recovery time, and there's a less than a 3% chance of reoccurrence, meaning that once you have the repair with laparoscopic mesh, that the chance of you opening that hernia up again is less than 3%. So that for me was the right choice. It's going to be up to you for your certain decision based on your circumstances, whether you want to do it open surgery where they literally slice you open from your abdomen and then fix it, or if they're just going to do the robotic and fix it minimally invasive is what they say. That's up to you, but I chose to go laparoscopic. Surgery went well. This is day 6 post-op. Day of surgery, went in. I was released about 2 hours after my surgery was completed. It was a approximately 2-hour event. Obviously, they knocked me out. I was under anesthesia. I don't remember anything of it. So let's talk about the actual procedure. They ended up numbing me. They put a nerve block. They basically got these 2 long needles and they injected whatever they do into my nerve in my abdomen to basically just numb everything down there, so you couldn't feel anything. So after surgery, I was feeling fine. They gave me some medication, so I really was comfortable. I was able to walk with assistance. I had a little cane, or I could walk, but just very slowly, with relatively no issues. That night, about 12 hours after the surgery, after that nerve block wore off, is when the pain really hit me, and it was miserable. Getting up from a seated position, from any sort of chair, whether it's a low height, higher height, was miserable. It felt like literally all my insides were just tearing apart. That was the first night. After that, things got better. Obviously, with sleeping, it's hard to lay down flat after this surgery, because getting up or using any sort of motion that involves your abdomen is painful, to say the least. So you're gonna have to sleep sitting up. The best thing I did, it was sleep on the couch. I propped some pillows up and I slept basically leaning backwards on my couch, because that was the easiest and most comfortable way for me to get up after sleep, and just provided the most comfort from positionally, as opposed to laying flat and trying to manipulate these abdominal muscles that have been ripped apart. After the first day of surgery, day 2 and day 3, kind of the same thing. It was very hard to move around, to get up. I definitely had to have some family stay with me for a couple days, just to help, do odds and ends around the house, because you really don't realize how much you use your abs for everything. From sitting up, from standing, to washing dishes, to scratching your hair, or even taking a shower. It's putting on your socks. That was a battle. I could not put on my socks. So yeah, just you got to keep that in mind, that you're going to be hurting and you're going to need some help for at least a few days following. If your doctor prescribes you stool softeners or any sort of pain medication, take it and start it early, because you don't want to get behind the 8 ball with having issues with constipation or anything else, when you already are super sore. All this trauma has been done to your abdomen, and pushing and trying to have a bowel movement would just be miserable. Luckily, I took my stool softeners, and it's kind of a funny subject, but I was able to have a bowel movement as normal. As well with the pain medication, whenever you're taking any sort of narcotic pain medication, for me, they gave me oxycodones that can provide you some constipation. So start that stuff early, just to give yourself, a better shot of having relief when you need to go. Make sure you're drinking plenty of water. Start with some fluids, nice and easy, soups, clear liquids, water, juice. That's kind of what I did, and I was able to eat fine within the day and the days following. About day 4, after my surgery, when I was really able to move around without much difficulty, I was able to actually get myself up, walk without a cane, use the bathroom. And again, I'm on day 6 right now, and it seems to be just getting steadily better each day. I was able to drive today with no problem. I know after the 4th day, I attempted to drive, and it was just miserable. It hurt to press the gas. It was just uncomfortable. So I don't recommend driving if you're not feeling up to it, but it will get better. Just keep improving. Follow your doctor's instructions, take your medications, and make sure you don't stress those muscles or do anything to, really irritate that area and irritate what you have going on down there, especially if you have a mesh operation or open operation. You just don't want to have to go back. Some other complications that I had, not really complications, just side effects, obviously. Swelling, my abdomen was super swollen. I had a massive beer belly, and that was not okay. As far as pain, the pain was definitely there, kind of below where the hernia and where they made the incisions for the robotic machine to correct the hernia, was in pain. Also, my testicles and my penis got huge, like swollen. And don't be alarmed, that can happen, just the path of least resistance. The blood flow is going to go down there. And I was having some pretty significant pain over the last, the initial, I should say, rather, probably 4 days. But that's kind of subsided now. Like I say, it's almost day 7. It'll be a week tomorrow post-op, and all those kind of symptoms or side effects are kind of resolving. So just, keep those things in mind. I'll keep you guys updated. I might post another video in a couple weeks just to see how the recovery is going. But yeah, it's something that needs to get done. If you have a hernia, get it fixed. 1 in 4 men will end up having them, as a result of that inguinal canal. That's the canal where your testicles drop, after puberty and in development in the womb. So men typically have that natural defect from birth or just from, our genetic disposition. So again, get it fixed, and hopefully I wish you guys a speedy recovery. We'll talk to you soon.